Welcome everyone to today's webinar, Introduction to Palliative Care, Debunking Myths to Improve Cancer Care, led by Dr. Caroline Cubbinson and Dr. Lindsay Yulin. This program is hosted by the Blum Resource Center. Over at the Blum, we are grateful to this team for joining us here today. The recording of this session will be posted on our Blum YouTube playlist and our Blum Digital Resource Center. For those of you watching live, if you have any questions related to today's program, please feel free to utilize the chat feature throughout the session. Your questions in the chat will be used to moderate a Q&A. If you have any other questions or would like more information about resources and programs offered through the Blum, please visit our website at www.dana-farber.org/resource center or email us at blum_center@dfci.harvard.edu. Thank you all for joining us. I will now pass the workshop over to Dr. Cubbinson and Dr. Yulin.
Thank you so much, Sierra, for your introduction, and thank you all for joining us today. I am a palliative care doctor here at Dana-Farber. I work in both the inpatient and the outpatient centers. And together with Dr. Yulin today, we're excited to be able to share a little bit more about what palliative care is and isn't, and hopefully how it can help you or your loved one as you're going through cancer treatment. So first off, what the heck is palliative care? It's always the first question I ask patients when they come see me because I think that there are a lot of misconceptions about what palliative care is and can offer. Generally, I like to describe palliative care as a specialty in medicine where we receive additional training that sometimes oncologists and oncology teams might not have around a couple of different areas. One is we're experts in symptom management. And so things like pain, nausea, anxiety, difficulty sleeping, fatigue, all of those things, whether they're being caused by a cancer directly or the cancer treatments that you or your loved one are receiving, there's a good chance we might be able to make them better. We also like to add an extra layer of support for patients and their families as they're going through cancer treatment. And the way that we do this is by getting to know individuals as best we can and understanding what matters most to them. Through this, we're able to add a layer of emotional and spiritual support. We're also able to help with communication. And if, in the future, medical decision making arises, we're able to serve as a sounding board to help you decide what treatment might be right for you. We do this through a team-based approach where we work closely with nurse practitioners, pharmacists, social workers, chaplains, all with the goal of helping you feel as well as possible. I'm going to turn it over to Dr. Yulin now as we go through some of the most common myths that people have about palliative care.
Thanks, Dr. Cubbinson. So the first myth is that palliative care and hospice are the same. And this is the most common misconception that our patients and their families tell us. A lot of people have heard of hospice, but not palliative care. Well, the reality is palliative care can benefit a patient at any time in their illness, even on the day of diagnosis and beyond. So they are not the same. Next slide, please. The second is that palliative care will replace your oncology team. This is not correct either. So it's actually getting extra care. We work closely with your oncology team and help manage your symptoms, particularly things like pain, nausea, vomiting. We offer an extra layer of support and do that very collaboratively with your oncologists.
Another thing that patients sometimes tell me is that they're afraid that if they get palliative care, that means that they can't continue getting active cancer treatment at the same time. And the reality is that palliative care can actually greatly improve your experience as you're getting active cancer treatment. I think about all the patients at Dana-Farber who are enrolled in clinical trials and receiving even the most aggressive care, such as a bone marrow transplant. More and more data and research studies are showing us that early palliative care can actually make that experience better and reduce risk of things like anxiety, stress, and depression, even months and years after you finish your treatment. Additionally, I think a lot of my patients come to me worried that pain management means that all they're going to get is morphine or a recommendation for the other opioids. And many patients are interested in other options. Thankfully, we have so much rich and diverse training in palliative care and are resourced and work with really incredible pharmacists that we really try to be creative and think outside the box to try to find pain management plans that can help individual patients and fit their lifestyles. So while morphine and other opioids can be a part of that plan, we also like to think about other ways to manage pain, looking at it from all different angles. And that includes using medications like adjuvants and also thinking about possible interventions that could help with pain management. Things like radiation treatments or, steroid injections or nerve blocks. And so if we think that a patient would benefit from any or all of those things, we often recommend them together.
And finally, our last myth is that palliative care means giving up. Palliative care is not giving up. We support patients receiving all kinds of treatments for their cancer, whether that's chemotherapy, radiation, or surgery. Nothing is taken away. Really, we are just an extra layer of support for both you and your caregivers.
Thank you for joining us today. And if you're interested in talking to palliative care, I recommend you talk to your oncologist and ask them if palliative care would benefit you. I know that on behalf of the palliative care department at Dana-Farber, we would be thrilled to meet with you or your loved one and see how we can help you start living a better life. Thank you.
Thank you so much, Dr. Cubbitson and Dr. Yulin, for that important and detailed program on palliative care. We do have one question that came in, and to our folks in the audience, if you have any questions, please utilize the chat or Q&A feature, and we'd be happy to read them off. But the first question we received is, can you talk a little bit more about how does palliative care support someone's family?
Yeah, I'm happy to take that question. It's a great question. So in palliative care, we really approach care thinking about both patients together with their families and loved ones, caregivers. We know that having cancer doesn't just affect you as the patient, it affects everybody within your support group. And so we want to make sure that everyone is getting care and support throughout your cancer journey. So we can help with making sure communication to your loved ones is clear and they're getting their questions answered too. We can also help connect them to resources, and we make sure that everybody is on your care team.
Great, thank you. I don't think we have any more questions at this point in time. As mentioned earlier, this session was recorded and it will be posted on our Blum YouTube playlist. So please keep an eye out for that. And thank you all for joining us today.